Good afternoon, Ms. Fisher.
Hi.
Hi, my name is Ashley Marker, and I am the nurse manager on floor E.
Hi, nice to meet you.
Nice to meet you too. So you can have a seat.
Okay.
So you're here for the med-surg position on our floor?
Yes.
Great. So just a quick overview of the job description. So our medical surgical nurses are responsible. They're responsible for the care of patients for either surgical complications or medical complications. So typical responsibilities include vital signs, medication administration, just doing communicating with patients, physicians, the healthcare team,
Okay.
patients' family, and so we also expect our nurses to plan and coordinate care. And that's just a few of our requests that we ask of you. So now you know a little bit about what I expect. I just wanted to know about, tell me about yourself.
Okay, so I have been a medical surgical nurse for 5 years at Pennsylvania Hospital. And due to some family issues going on, me and my fiance have decided to move back to Delaware.
Okay.
And I was particularly interested in applying for a position here at Christiana because when I was in nursing school, I did my clinicals here, and the nurses were very welcoming and invited me to a lot of teachable moments and just kind of took me under their wing in that small amount of time. Mm-hmm. So being that I graduated nursing school and I am a nurse now, in any way that I can give back to them or be that for someone else, I wanted to have that opportunity. And being that I had such a good experience at Christiana, I could only imagine how it would be working here.
Perfect. Great. Yes. So just tell me why you think you're the best person for this job.
I believe that I am the best person for this job because I feel like I'm very adaptable to many situations. So if I need to be an older sister to a teenage parent or to a teenage patient, I can. If I need to act as a mom to maybe a sick 5-year-old, or if I need to step into a leadership position when appropriate, I can. I feel like I can do the basic steps needed in those type of situations in order to make sure no harm comes to the patient, in order to keep the situation under control. So I feel like I'm very adaptable, and I think that's a skill that many nurses should have, or at least work towards having, because you never know what's going to walk through the door.
I absolutely agree. That is a quality that I just admire in nurses, that they're able to adapt, just because you never know what you're going to walk into on your shift on the medical surgical floor. So that's a great quality to have. What do you find is the most rewarding about being a nurse?
I think the most rewarding is, I would say the most rewarding is knowing that the patient actually felt as if they were being taken care of, mm-hmm. and as if they were the only patient that the nurse had that day. Like, I know some days I go in and I feel like I was completely unorganized. I feel as though I didn't give my patients enough time that I thought they deserved, and that I was just all over the place. But I could be leaving for the end of my shift, and a patient just says, thank you for doing this for me today, or thank you for doing that. And I'm not looking for any recognition, but it makes me feel good. Like, okay, even though I didn't feel good, at least they felt good at the end of the day, and that makes me want to come back the next day and do better and make sure I can give them the time that I thought they needed, even if they feel as if they had all the attention.
Yes, I understand. It can be very busy on our floor, and our nurses feel like that they have to rush through our patient care in order to get their tasks completed. But it's very important to focus on our patients, mm-hmm. and make sure that they're attended to and they're listened, that they can just vent on our
Right.
nurses and get all their frustrations and concerns out. So, can you describe a time when you were put into a leadership role, and then how did you handle that role?
So just recently, actually, at my old hospital, for our floor, I organized for our staff members to participate in a 5K run for Breast Cancer Awareness Month. So even though that wasn't directly related to patient care, it took a lot of planning and organization to first I had to contact the leaders of the run and make sure we got our team registered, and then I had to order t-shirts. I had to make sure I was communicating effectively with the staff and letting them know where to meet at, how much the registration fee was going to be, what time, what place, all of that. So at the end of the day, it ended well. It was a lot of work to go into it, but we all had fun. But that's just a few of the things that went into organizing that race and that I was put in charge to do.
Okay, that's wonderful to hear. We have so many different benefits throughout the organization, and they're always looking for volunteers and fresh inputs on things. Maybe we can improve on some of them. So that's wonderful to hear that you actually organized and carried out these plans. Now, tell me about a time when you had a difficult patient, and how did you handle that situation?
So thinking back to my first year out as a new nurse, I remember that I had a sundowner patient. So during the day, they were very pleasant, very easy to take care of. But as with any sundowner goes, towards the end of the day, they were combative, kind of belligerent, wasn't accepting my care. And at that point, everyone was just ready to medicate the patient, and if it came to that, use physical restraints to get them to calm down. But I first wanted to try more therapeutic measures. Like I got him his favorite hot tea. His wife was in the room as well, so she was in there talking to him, trying to calm him down. I'm trying to calm him down as well, making sure he's comfortable. And luckily, towards the end of the night, he ended up going to sleep, and no little medication had to be used, and there was definitely no physical restraints. So instead of going straight to the hard and heavy, medicate, restraint the patient, like I try to work through the situations, do the most comforting things first, and then move on to harsher methods. So I think that situation will stick with me probably for as long as I am a nurse, because it definitely was a new experience, something that I never went through or even thought I could think of, especially just being 1 year out of nursing school. So I would say that's one of
That's wonderful. We see so many different patients. Some of them are easy to work with, others are difficult to get along with. And I admire the fact that you took the more therapeutic approach instead of using chemical restraints or even physical restraints. So it's nice to know that that you just have a care for your patients. So can you tell me a time when you were under a lot of pressure? I know that nursing can be, there's lots of pressure. So can you tell me about that time? And then how did you get through it?
So sorry to pull back to my first year of nursing, but I've just built on those experiences that I've had and learned from them, and I feel as though I'm working better through them. But I remember I had a patient who was completely immobilized. I had another patient who's having swallowing issues, and I think I was also assigned one more patient who was diabetic. So we had to make sure you were on time with his insulins and checking his blood glucose, taking his vitals. So that was a lot. I had my preceptor with me helping me, but she wanted me to think through the process of how would I care through for that patient. What would I do first? What medication would I administer first? What patient should I assess first? And that was a lot for me. Especially with each condition of the patient being very crucial and time sensitive, especially with like the insulin stuff. So dealing with that, it was a lot of pressure, but I can take from that situation, and I now am better able to prioritize my patients, better able to prioritize medications and vital signs and care. All of the patients are important, but one of the things as a nurse is knowing which one to attend to first. So that was definitely a lot of pressure for me, but I'm glad my preceptor did that for me because it taught me a skill that I still use today.
Yes, we that's nursing. You just have to prioritize all of your patients, and so it's great to see as a new nurse that you recognized that skill, and it's something that yes you'll learn over time, and then you'll just continue learning it throughout your nursing career. So well, I would say that you just seemed like a great fit for this position, and I wanted to thank you for
thank you. It was nice
coming
meeting
in. You too. So you just seem like a great asset for our team, and a final decision is going to be made by November 3rd. The start date for the position is November 20th. So if you are selected, we will have an orientation phase. So that does begin on the November 20th and it lasts for 6 months.
Okay.
So do you have any questions or concerns at this time?
No, I think I'm good. I really appreciate you giving me your contact information earlier. So if I have any questions about today or about the orientation process, I will definitely make sure to contact you. Thank you for that.
Wonderful. Well, it was a pleasure.
It was nice meeting you too.
Thank
you
you.
so much. Thank you.